Very good afternoon, everyone. I thank AIOC for having given me the opportunity to be a part of this wonderful Apex conclave. And I'm here to reiterate a few points on that a publication is a must. After Krishna finished preaching Gita to Arjuna, Arjuna had a doubt. What did Krishna say? I think it's difficult to remember really all the verses. Then definitely, good that Bhagavad Gita was published. Definitely, otherwise Gita would have been lost to mankind. Right, all of us do think, why should I publish? Yes, I have patience and practice, I won't perish, but I'll only flourish, whether I publish or not. That would be the common attitude amongst all the clinicians. But yes, knowledge is definitely the property of entire mankind, and if you do not write it, it is lost without the written records. And it cannot be widely circulated without effective duplication of the knowledge. And therefore, the medical knowledge or the communication among physicians is definitely by means of the greatest part of the communication takes place within the network of medical journals. Yes, do we have some findings which are credible ones enough to disseminate publicly? Then why not we make sure that they enter the permanent searchable public record? So definitely they are the currency of the world of science. Now, as a clinician, yes, if you publish a case report, you know that such things, you can tell the world that such things do exist and it can be handled this way or should not be handled this way. Now, if you publish a case series, definitely you are describing the typical and the atypical manifestations or spectrum of manifestations of the disease, and also similar or dissimilar findings can lead to some new discoveries as well. Now, original research, one of the highest, as considered as the highest in the order of publication. So you make the scientific or the medical world know that what research you have done, and also if it's a novel one, definitely you are the authority in that. And reviews, yes, definitely the synopsis about the area of your expertise can be dealt with. Yes, don't perish but flourish by publishing. Now, as a clinician, yes, if you publish, definitely you have a professional visibility, and the Googling patients definitely tell you that I found your name elsewhere when I was searching the data, and yes, this acts as a bonus for you. So evidence-based medicine definitely comes only with publication. Now, as an academician, it's a marker of academic success. Then by writing the aims and objectives, definitely you have the name and fame, and you're also responsible for getting some grants for the institution as well. And then yes, a role model for the postgraduates to publish and do research. So definitely the impact of a high publication in a high impact journal or the scope of a Scopus index journal is definitely beyond the material gains. Now, definitely getting cited by others definitely improves our performance, as well as you get recognized by the institution, and as well as the people who matter the most. And definitely some of them do even know you by the initials because they would have cited your article. And then as for a staff or a faculty, definitely if you publish and get promotions, for the promotions, definitely publications do become mandatory. So publish and flourish should be the mantra these days. And as a researcher, yes, if you have done a research, if you have found out some novel topic, it's definitely better not to hide them and publish it and publish it. It's like if you do not publish it, you have manufacturing a product and not launching it. Now, it forms a permanent database and a permanent searchable record. Now, on the personal front, yes, you have a practice of writing manuscripts. The whole process of writing a manuscript is definitely enjoyable and improves your writing skill too. It's like a kind of relaxation when you're caught amidst all of your academic activities. It's kind of relaxation. So those interests like writing, statistics, etc., which was on the back burner, definitely can be rekindled. And on the personal front, you have great gains with respect to knowledge and updating. And also, you know what's going on in the world. So epidemiology of diseases which are prevalent in other parts of the world also can be known. So definitely you have some kind of a comparative data with you. And then publish to gain, otherwise you will lose. So you're giving back to your institution by means of ranking systems, increasing your ranking systems, and also marker of accountability and measure of research productivity. Yes, so the importance of publications definitely cannot be overemphasized. So we have chosen a medical profession, and it is our duty to keep abreast with the newer concepts and newer knowledge that have been there, and then definitely that helps in having a good patient care. So the take-home message is there are so many advantages that why should I publish, and therefore I wish all of you a happy publishing time. Thank you.